Hi, thank you Matt for your time today. Really appreciate it. Now, one of the things that I struggle to explain to other people, so I thought it'd be good if you explained it for me, or for us, is how does the CO2 laser in general work? What does it do to the skin?
The CO2 laser, when it's targeted onto the skin, by generating heat, essentially the top layer, the epidermis, is vaporized. And also the CO2 energy goes into the deeper layers of the dermis of the skin, and that stimulates new collagen production. So you have an immediate effect where the skin, the top layer is, as we say, is taken off, but then it takes several months for the collagen to then mature, the new collagen that's stimulated to mature, so the skin gets tighter and smoother over a course of 3 months to 6 months.
And there's a bit of a confusion about fractional and ablative. So could you explain for me the difference between a fractional CO2 laser and ablative CO2 laser?
Essentially, it's the same device. It's all about the technicalities of the settings. So ablative CO2 is where the laser energy is directed in a very hyper-focused area, and fractional is where it's spread out over a larger area, so there's gapping between where the energy is delivered.
Could you give us some examples of when you would recommend an ablative CO2 laser treatment over a fractional CO2 laser treatment?
Sure. So if you're looking at, for example, lesion removal, we would definitely be using ablative CO2 then, because we want the energy very high power, very focused onto a small area. So we could be removing things like moles or keratoses, excising skin tags. So we can also almost use it as a cutting device.
Oh wow, okay, didn't realise. Right. But would it be an ablative treatment if you're dealing with things like acne scarring?
So by using ablative treatment, exactly, for acne scarring is beneficial because you are penetrating deeper and you're causing more trauma. So there's a longer downtime, the recovery is longer, but the benefits are greater.
So with then, zipping back to the fractional treatment, my brain's thinking, okay, a fractional treatment is more of a skin rejuvenation treatment, and an ablative treatment is more of a, like an action thing. It's dealing with a particular issue.
Yeah, so you can use ablative CO2 for resurfacing as well, but the recovery is going to take much longer, potentially up to 3 months if truly done ablative.
So it's a choice of how severe you want that treatment to be if you're looking at skin rejuvenation.
Yeah, so it's exactly correlational as the benefits with the downtime. So the deeper you go, the more energy you're providing, the more trauma you get, and with just a one-off treatment, and therefore the greater the benefit, but then you have a longer recovery. And you can achieve the same benefits from doing treatments over potentially three sessions of the same treatment, but with less downtime after each one. And so it really fits into, what is the patient's schedule, how it suits their life best. So they want, one aggressive treatment as a one-off with a much longer recovery, or to get the same results spread it out over a longer time with less downtime.
What's your thoughts on the safety element of a fractional CO2 laser versus an ablative CO2 laser?
So if we are talking truly ablative for a small area, the recovery is okay. And from a safety perspective, we always try and do the best thing for our patients. So we would recommend not doing ablative CO2 on a very large area of skin, because the chances of complications and risks are greater.
What's your thoughts on the idea then of the fractional CO2 laser treatments, the 3 treatments, the lesser energy within that 12-month period, and from a safety point of view, would you say it's safer for skin rejuvenation?
It is safer because you're going more gradually, getting the same benefits, but just with less downtime, recovery, and less risks of complications.